Whitney Castine, the chair of the State of Black Health National Conference 2018. And we've gathered here in Atlanta, Georgia to really celebrate all things about black health, but also to strategize on how we can best take care of our people and pass along some information that is critical to us living our best lives.
Over 350 people from different professions, public health professionals, community-based advocates, faith-based leaders,
social justice advocates, medical professionals, researchers, creatives who are doing spoken word.
Even some representatives from our state and local government.
All here talking about one topic, black health.
What you're looking at is a celebration of what we have done.
With this conference, I see incredible opportunities. Let's convene, let's come up with an action plan.
This has been a great opportunity to see other people who are involved in great work around the country. It's about networking, it's nurturing and sustaining partnerships over time. It's been exciting, it really, really has.
Today I've had the opportunity to be in the room with people that I never even imagined myself being in the room with, including the United States Surgeon General Adams.
I know we'll achieve our individual and our mutual goals when we sit at the table together, when we share lessons learned, and we challenge each other to do more, to do better, and most importantly, to do it together.
At this conference, we've been able to discuss a lot of topics ranging from HIV and AIDS, heart disease, obesity, physical activity, sexuality, so many different things that impact the world, but specifically looking at health disparities and health equity in the black community.
We just had an awesome panel
on things that we're not talking about as a community.
So I'm here really to talk about how to prepare for end of life, how to empower our community.
I'm here to talk to you a little bit about LGBT health.
To be on the East Coast having this conversation with you guys, I want to just bear witness to the revolution that's happening.
The different topics of each session shows you how vast and diverse the topic of black health is, and I think it's important that all of these topics are discussed at this conference this week.
Imagine still on a bike at 18 and permanently losing the right to vote. That we did that, like we made that up. And part of this is realizing that the only way we'll win is like peeling back all the bad things, but that is not enough.
Throughout the conference, we're given little opportunities to kind of tell our story. And so whether that's through photo booths or writing down your mission or cause, we've been able to give different opportunities to talk about how we plan on addressing the state of black health.
When you talk about black medicine, black health problems, who is going to study them if we don't?
They say just because you're in the water doesn't mean you're gonna drown. I wonder what they'd say if they knew you were never offered a life jacket. Advised against telling anyone you never even learned how to tread water. Instead, as a kid, you were given crash courses on swimming with sharks. See, most of us were born of sacrifice and raised on survival. Don't you get tired of wearing your armor beneath your work clothes? Being battle ready like you're preparing for a secret mission. This is war.
Now more than ever, it's important for us to have these conversations as we look at how many years we've been plagued with health disparities and addressing health equity. It's time for us to act on the call of action to address health inequities.
We need to make sure that the message gets out to those who are marginalized and who could not afford to be here. Amen? Too big to fail, too important to fail.
Yeah. So you have to be alert, you have to pay attention, and when something doesn't feel right, you gotta question it.
Being here this week has really re-energized me and actually has affirmed me. It has broadened my perspective around my role in shaping policy. Black health should be important to everyone.
We have some tremendous opportunities ahead of us, but we've got to go after them, and we've got to continue to fight for changes in policy.
We have had so much fun. We've learned so much. We've grown so much. We did this together. We shared our stories and our experiences. We want to thank everyone for coming, everyone for participating. If you enjoyed this one, then we'll see you next time in Charlotte, North Carolina for the State of Black Health 2020. See you there.